guys, I'm Kat. I'm one of the overnight nurses here at Premier Veterinary Group in Chicago. And I'm going to take you behind the scenes a little bit and kind of show you what we do when we need to set up for what's called a laceration repair. A lot of times people will come in because their animals have an open wound or a cut that needs to be sutured up. So I'm going to kind of show you behind the scenes on what we do to set up for that. So everything we have here has been through an autoclave or comes in a pack, so everything is sterile. We have a sterile bowl that we'll place flush into. We have sterile flush over here that we will pour into the bowl that is used to flush out the wound. In order to get that flush into the wound, we have a catheter and a syringe that will be used to flush out the wound. We have sterile instruments here that the doctor can use. We have a sterile drape over here that we will place over the entire area and cut out a hole so just the wound will be open. We have extra sterile gauze here if needed. We have a scalpel blade to attach to our scalpel handle. We have two different types of suture. We have non-absorbable and absorbable, just whatever the doctor prefers. And then we also have a drain that may or not be needed to sew in, and that is so that the wound can drain properly. All right, so on the other side, which is the monitoring of sedation, most animals that come in for wound repairs don't need to be under full anesthesia. They need to be under light or heavy sedation, so they will not be needing to be intubated using the ET tube, so we actually won't use this unless it's required. So what we actually do use is what's called flow-by oxygen. So we have an oxygen mask. The pet's face will go right in here and be allowed to breathe the flow-by, and that's connected to our oxygen line. And then as far as monitoring equipment, we have our SurgiVet, which we use to monitor things like heart rate and heart rhythm with an ECG. We have the blood pressure cuff that we can use to monitor blood pressure. We have the SpO2, which monitors the oxygen saturation levels in the blood. And then, of course, in order to set up for the wound repair, we're going to have to clean and clip that area. So we have sterile lube that we can apply to the wound so no hair gets in there as we're clipping with our clippers. And then lastly, we have our eye lube. So we're going to put sterile lube into the eyes to make sure that they still stay well lubricated. Now, of course, we have all the machines, but we're not always going to rely on machines. We're going to rely on things like our stethoscope and our eyeballs because those are our best tools that we can use.